Hi, I'm Ellie Burton from York St John University. This is the first study of my PhD and it investigated the effects of mental imagery on predictions of behavioural engagement in depression. Prospection is important in mental health because we pre-experience potential emotional consequences when thinking about hypothetical futures. So if we simulate a sad future event, we're likely to feel sad in the present moment too. A large amount of cognitive therapy focuses on verbal thoughts in the past, and researchers have since suggested that the role of future thinking may be overlooked. It's been suggested that encouraging verbal thoughts may lead to a deterioration in positive mood compared to positive imagery, which could lead to improvements in mood. So imagery-based strategies could lead to improved therapies to treat depressive symptoms. 2 previous experiments were conducted which explored how positive imagery of future events impacts predictions such as importance and control in depression. It was found that positive imagery interventions resulted in more positive predictions of the future. Based on this previous research, the current study aimed to extend these findings by exploring the effect of mental imagery on changes in short-term goal predictions to modify prospective cognition. It was hypothesized that dysphoric participants would experience lower motivation and perceived likelihood of carrying out their future short-term goals. It was also anticipated that after the imagery intervention, goal predictions would become more positive compared to the verbal reasoning task. 144 participants were recruited for this study, and it was a non-clinical sample. First of all, participants reported their demographics and momentary mood. Their depressive symptoms were measured using the CESDR, which categorised them into 2 groups of either dysphoric or non-dysphoric. Participants then chose 4 day-to-day activities that they would like to do in the near future, such as a woodland walk or going to the gym. They then rated each activity in terms of perceived importance, likelihood of engagement and control, amongst others. Participants were then randomised into one of 2 conditions. In the mental imagery condition, they listened to an audio guide for each of their activities which asked them to close their eyes and vividly imagine engaging in their activities. In the verbal reasoning condition, they also listened to an audio guide for each activity, but this time thought about the reasons why they'd want to engage with their activities. They then completed a jigsaw as a distraction task and finally rated their goal predictions and momentary mood once again. The main findings of this study were that mental imagery was useful in improving both vividness and anticipatory pleasure. The surprising result was that participants felt reduced feelings of control after both the imagery and verbal reasoning intervention. This contradicts previous research, so further investigation is needed. There were several main effects of time, which suggests that verbal reasoning tasks may also be beneficial in improving people's future thinking, which also differs from previous research.